All right, so Alzheimer's disease, abbreviated AD, is super common in the elderly, especially. I'm guessing you all have people in your life who have had Alzheimer's disease. It's that common. I have loved ones who've died from Alzheimer's, and recently, in fact. So if you look at, I don't expect you to sort of memorize the prevalence, but sometimes you get some interesting information from it. 50% of people 85 years and older get Alzheimer's. So, I mean, that's a lot of people. Yeah. And in fact, this is in the top 10 leading causes of death in the US. By your textbooks, it's saying it's the 6th leading cause, and that some people put it higher than that. So, you know, your notes right here say that incidence is tied to age, and that's true for most Alzheimer's, and but there is also an early onset Alzheimer's. So some folks do get it earlier. This is a progressive degenerative disorder. Progressive meaning, you know, it continues to get worse and worse. Degenerative, there's a breakdown of some tissues in the brain, and we'll take a look at which tissues those are. There's all kind of changes that can happen with this, and we will get into those in more detail, but kind of the overall is that it causes memory loss, personality changes, and even death. Alzheimer's is the most common form of dementia. Dementia is kind of the more like a general term or umbrella term for cognitive degeneration. And Alzheimer's is this specific type. More women than men get this, but that may be tied to longevity. There's a higher rate of prevalence in African American and Latinx folks than Caucasians. It is unclear why either. There's so many factors to this. They haven't tied it to just a few. There is some evidence that regular physical activity, healthy diet, strong social systems, and lifelong learning seem to be helpful or preventative. Questions so far? So things that are observed as far as actually in the brain are plaques and tangles. And this is something that you actually could be tested on, you know, in your licensing exam. And this is, you know, again, a very common condition. So a plaque in the brain is a deposit in the neurons of a beta amyloid. And this gets sticky in the brain, and it can stimulate an immune response and end up killing affected tissues. So that's the plaques. And there's also these things called neurofibrillary tangles. There's this protein called tau that basically acts like scaffolding or cytoskeletal structure that supports the long fibrils in the brain. And when this kind of breaks down, then the long fibers are no longer supported. And so they're no longer making their synaptic signaling. So there's a decrease in transmission. And without that support, those long fibers actually end up getting all tangled together. So that causes the twisted tangle mess of tissue that's not, the neurons not sending their signals anymore. So between those two things, this is what it can look like. And this is just the picture in your textbook. Did you say the axon fiber? Yeah, yes. Yeah, because the tau, which is the protein, stops supporting them. And there's a little bit of a glare here, but in case you're not looking at a textbook, this is some of what the tangles and plaques could look like in somebody who has Alzheimer's. Can you differentiate there what the tangle is? I cannot, no. Just that this is the side that's damaged tissue and this is the healthier side. You also actually get some characteristic shrinking, and some changes actually in the grooves and the sulci. And I can see the shrinkage, but I can't tell you what's a plaque and what's a tangle. All right, so back to our notes. So again, this is progressive. So different stages, but what happens is there's fewer brain cells are functioning. Actually, there's a drop in neurotransmitter levels, and also the hippocampus shrinks. So there's inability to process new information, which can be one of the earlier onset symptoms, or one of the early symptoms. Not remembering recent conversations and new information. So, there's a lot of contributing factors, including genetics. And some of these other issues may also contribute, like chronic inflammation, history of head injuries, exposures to toxins, high cholesterol, low estrogen, and other things. So this again is often progressive. The timing of the progression can vary, and the exact signs and symptoms can vary. It could take the average progression rate is somebody from diagnosis might have about 8 years to live, but that could vary greatly from like 4 to 20. But our mild Alzheimer's, we were kind of laughing about the mild Alzheimer's because it sounds like I already have it. I mean, I shouldn't joke about it, but I was reading the signs and symptoms and it sounded a lot like things I already do. Frequently misplaced possessions, occasional word loss. Yeah, there's other signs and symptoms as well. As it progresses, the person might actually get lost or can't handle basic tasks as that gets, progressing. They might not be able to get dressed, or so a lot of folks with Alzheimer's, right, need a lot of extra care and help. Oftentimes this is family members. Oftentimes it's professionally, right. In fact, this is the most expensive care in the United States is caring for folks with Alzheimer's. And that's not even counting, all the unpaid hours, of people caring for their loved ones. So as if it progresses, there's more memory loss and confusion often. It could be more disorientation, even like temporal sense in time or space. There could be more difficulty with written and spoken language. And it could even lead to hallucinations and paranoia. But again, the presentation between people can vary quite a bit. And again, since this is so common, and I'm guessing a lot of folks who have it, you've probably seen sort of the differences from people to people. So some people, for example, might be very sort of more peaceful, I would guess you would say, in their, in their forgetfulness and in their challenges. And other people can get quite aggressive with Alzheimer's. And in fact, there's different types, and some of them kind of tend to lead to more aggressive behavior. And then if it continues to severe Alzheimer's, people might lose all their ability to communicate, and people sometimes even die related to other things like pneumonia or progressive organ failure. Questions or comments so far? So the treatment, we don't really have any treatments that like totally stop it or reverse it or cure it. So the treatments focus on slowing the process and, managing the other problems that come along with it, such as depression and anxiety, keeping folks as safe and comfortable as possible. And here's some of the medications that are used. Including, you can see some medication for inflammation and anxiety and depression, et cetera. So as far as massage, massage is indicated for Alzheimer's. There's been actually some research to indicate that the massage can help with the restlessness and even combativeness, and sort of help people keep them calmer. There's also been research to indicate that, massage of the back and the hands has been really well received by the elderly in general. There's been research in a 2017 systemic review that touch had a positive impact with some of the signs and symptoms related to dementia. In general, massage can be hopeful. Depending on how far the person has progressed and how well they're communicating verbally, you have to pay attention to, is the touch welcome, and can the person, communicate for, consent? Are they enjoying the massage? And watching for nonverbal cues and all of that. And many times either their loved ones can be helpful for that, because they kind of know oftentimes their sort of patterns and how they communicate, or the folks taking care of them, like if this is at a home. Many massage therapists, for example, will focus on working at different senior homes of different care levels. And so, of course, if you did that, you would see a lot more folks with Alzheimer's. Body work won't stop Alzheimer's, of course. It won't reverse it, but it could help with some of the signs and symptoms, keep people comfortable and more with our sense of orientation and calmness and feeling better. I would think, right, you're thinking about all the things that come up with massaging seniors, which includes, right, that their skin is fragile, so you're not doing big, challenging, stretching things. It's thin and fragile and it can tear. They, in general, right, can have more fragile muscles, and so we're not doing as deep of a work. They might have more brittle bones, like you're keeping in mind all the other things that they might have. Also, of course, lots of seniors many of them are on lots and lots of medications, right? And many of them have many different things going on at the same time. So then you're looking at, right, the medications and the other factors, and there might be some serious heart or kidney or other issues where you'd want to get clearance for massage, and or just do like gentle, comforting massage. And sometimes, in fact, if you're working at a home for the elderly, sometimes you're even just working with folks while they're still in their wheelchairs and so forth, not even always getting them on the table. And again, sometimes, right, they might get like disoriented And so that might be part of like just keeping them where they're safe and comfortable, and just kind of gently massaging their hands and back and so forth. Yeah, so any questions about that?
Have you worked on any seniors?
I have worked with seniors, yeah, and at a home, and we've also done events. Yeah. If I'm totally honest, it's sort of my Achilles tendon of like hitting all of my heartstring spots, where it's kind of a lot for me to process. Some people are just really good at it, like they could do hospice care too. And I took care of all my grandparents as they were dying, and I've just got a real soft spot where, I have done some work with the elderly and in centers, but senior centers, but I think it's too difficult of work for me. It's not my calling, but I would certainly, and have done, the care for my elders before. Very close to my family. I cared for my grandparents, and I take care of my parents too. So, yeah.
I think I'm like there's a lot of things, areas where I would like to really help people, but it's painful.
Yeah, and of course, I mean, massage, right? We're kind of like processing stuff anyway, but I feel like we each kind of have like maybe certain areas where it's sort of we can do it maybe better, or certain areas where it might be like even harder for us, right? And yeah, it's beautiful, it's a calling, right? It's beautiful, important work, and not for everyone, right? Just like hospice work would certainly not be for everyone, but some people, it's such a blessing when folks do that work.
Yeah, it's different working with seniors. I work at a retirement home, and you connect with them, and then eventually, they pass, and then so you got that connection with them, and then it didn't last long. So
yeah, thanks for sharing that, Mary. Akeisha was
you have a bond with them.
Yeah. Keisha's sharing something kind of similar, but that actually it wasn't like a good, the bonding with the elders, that she actually quit that job, does other work. Yeah. But it's really great work. I don't mean to that this is just, I'm just sharing personally, honestly, but it's really great and important work. I think for me, it's closely tied to like caring for the elders in my life, and that perhaps I could process that, but it's not the work I'm going to focus on, I don't think. Except for my loved ones. Yeah. Any other questions, comments? Yeah. Yeah, really. Yeah. I guess one more thing comes up for me, since I've had some relatives die of this recently. Just another thing that comes up for me is that oftentimes the families are, of course, really taking care of folks, or the families are not, right? But I guess just to bring up that, a lot of times as a massage therapist, you kind of do have the opportunity to connect with the families too, or maybe, you're just massaging somebody who's shared that their father, mother, whoever has Alzheimer's. And so it's good to know about these things from the other side too, right? that the people who are caring for their loved ones, obviously this is a huge, a huge part of their life, and it can be obviously very stressful. It often obviously brings up family dynamics. There's often some family members kind of taking care of more of the day-to-day and or the planning, and others who have kind of bailed or kind of bringing up their childhood traumas. And anyway, of course, it can just bring up a lot. So even if you don't work with seniors that much, you just might work with folks who are, who are taking care of their loved ones. And there's a name for that too. And I'm kind of in the generation that's going through it right now. You guys might know the name. I'm spacing it, but if I describe it, you might remember, you might have heard of it, where that kind of age where you're taking care of your elders and your kids at the same time. I don't know if it's called the sandwich or I don't know, there's a name for it, but you will treat a lot of your clients who are in that, I don't know if it's called sandwich or what, but there's definitely something going on with your clients who are taking care of elders and kids at the same time. And, part of it is that they're taking care of others so much that the time that they get to be on the table is really critical and precious and rare for them to have those moments themselves. And, massage textbooks don't often talk about this because it's kind of like a little bit of sort of the kind of more abstract, not abstract, esoteric part of massage. And like, how do we like quantify or research these things that massage can help with? But I've seen in my own life and other people's lives that, massage can really help in these deep, profound ways. And if we want to describe it as, is this just getting somebody into their parasympathetic mode when they're always in the sympathetic mode, or why exactly it does this? But getting into that deep place in a massage, often people are able to feel and experience and release so much that's so crucial. It's just, I've seen it be, again, just super profoundly healing for clients and also myself. So, it's really, really important, beautiful work that we can do. Yeah. So that's what I got on Alzheimer's, unless y'all have any other questions or comments.
Whether it's Alzheimer's or somebody just caring for like someone who has cancer, like my mom had cancer, or any work that's ongoing and really, really hard, those people need a lot of love.
Yeah. So Anna's bringing up, you're talking about the people caring for people. Yeah. So of course, this people caring for people, right, is obviously whatever it is, whether it's cancer or, not just Alzheimer's, right? It was just coming up in that context. Yeah, but yeah, they need a lot of love and nurturing and some peace and quiet. And sometimes they need to talk and have some just kind of be an active listener. And then, of course, on the other side, too, which is, again, true for all kinds of seniors and not just folks who have Alzheimer's, but of course, Alzheimer's is hugely prevalent the older we get. But sort of on the other side, right, a huge issue with many seniors, but not all seniors, is that many are touch deprived. Many are in settings where they are almost never touched. So that, again, is just a really beautiful gift, for them to get any touch at all. There's all kind of research that it's extremely detrimental for humans to not be touched. And yet we have this these sort of structures where young people are often hardly touched and old people are often hardly touched. And sometimes folks in the middle are hardly ever touched too. And then COVID, right, has added to that, right?
Especially nursing homes and stuff.
Yeah, nursing homes and COVID and yeah, it's real. So I'm gonna stop this recording.